The East Baton Rouge Parish Library believes that a thriving business community is good for us all. That's why we help entrepreneurs start businesses with tools like Gale Business Builder. Keep commerce rolling by providing access to computers, printers, and free Wi-Fi at 14 branch locations. Get a library card. Grow your business at ebrpl.com/business.
Good morning and welcome to Strictly Business. I'm your host, Penny Font. This webcast features conversations with Louisiana's most influential CEOs, entrepreneurs, and community leaders, with the goal of providing insights, ideas, and inspiration to help you and your business grow. We want to keep Strictly Business as interactive as possible, so for those joining us live, here's an icebreaker question for you. Submit your vote in the comments, and the results will be posted at the end of the webcast. Strictly Business is brought to you by the East Baton Rouge Parish Library. Without their support, this project would not be possible. This month, we're talking with Dr. Curtis Chastain, a physician and healthcare leader in Baton Rouge. He is a native of the city and received his undergraduate and medical degrees from LSU. After completing his residency in internal medicine at Ochsner Foundation Hospital in New Orleans, he became board certified in internal medicine by the American College of Physicians. He has been practicing medicine at Our Lady of the Lake for over 30 years. Dr. Chastain is a director of the Lake Men's Health Center, a membership-based practice that provides comprehensive primary care to adult men. Dr. Chastain is passionate about men's health and is frequently invited to speak on topics related to men's health and wellness. He is also the founder and director of the Lake Executive Wellness Program, which offers the Executive Protector Exam, a comprehensive exam for men and women used in the early identification of chronic disease and also the two biggest health threats that impact longevity, heart disease and cancer. Dr. Chastain, welcome, and thank you so much for being with us.
Thank you so much, Penny, for having me. I appreciate you having me on.
So let's start with this. Please explain the concept of executive wellness and its importance.
Well, since I've been at Our Lady of the Lake and doing Lake Executive Wellness, I've probably performed over 3,000 executive exams. And there are three things that I know about executives. Number one, they're busy. Number two, they're tired. But most of all, number three, they invest most all of their time and energy in their business and their people, and they rarely take time for themselves. And the data, which is sad, because if something bad happens to a CEO or one of their top performers in a company, the data shows it would cost about 212% of that person's salary to replace them. And that's a lot of money, not to mention the possibility that a stock price goes down or something like that. So it's really imperative that executives find the same time that they invest in their company to invest in their own health. There's a popular book written by Simon Sinek, I'm sure most of your watchers have read, called Leaders Eat Last. And that's a great concept, except in healthcare. Probably not a good strategy if you want to live a long time.
I appreciate that insight. What are the benefits of regular health checkups for executives, and what should they include in their health screenings?
Well, doing health exams for generating health data. And health data helps guide decisions made for your healthiness. It's no different than a company using financial data to decide where to take the company. It's exactly the same. I mean, can you imagine running a company without access to financials? Nobody gets a financial spreadsheet, and I'm not an expert at it, but you have to have financials to know what to do. And just like in my world, you got to have health data in order to know where you are from a health standpoint. And look, let's take it this way. People die of four things in this country. Four things: heart disease, cancer, accidents, and what we'll call other. Other being something like dementia or Lou Gehrig's disease. Well, we can't do anything about that. We can't predict that. We can't predict an accident. So it boils down to two things: heart disease and cancer. The truth is, we can find the data that we need to identify the person that is supposed to die from one of those two things and never let it happen. That's the key. And we need data to do it. So the way we do that is we do, as you called it, a health assessment. It involves something as simple as knowing your blood pressure. So many executives come in here and they've never had their blood pressure. They don't routinely check their blood pressure. You got to have blood work. You got to have comprehensive blood work, looking at your blood count, your liver, your kidney functions, and all those things that we find in the blood work. You got to have a chest x-ray to both serve as a baseline, but also to look for things like cancer or any abnormalities we might see on a chest film. Coronary calcium testing is a must. It identifies that individual with heart blockage. A physical exam, I've got to lay hands on you. I've got to listen to your heart. I've got to check your valves. I got to listen to your heart rhythm. I've got to press on your abdomen to feel if there's any liver enlargement or any palpable kidneys or any other abnormalities. Got to look at your skin, because skin cancer is the number 4 killer in this country. And men have to have a prostate exam. Women need to have a pap smear. It's just all there is to it. So I know what you're saying, and a lot of people say this: how in the world, as busy as I am, can I get all this done? And the answer is, you have to get it done. If you want your best shot at being healthy, all of those things have to be done. And I understand it takes a long time. In fact, it takes probably about 3 months in the traditional medical arena to get that done. But there are places like Lake Executive Wellness that can do all of these things in one morning. Hope that answers your question.
Yes, absolutely. So very important. What are some common health challenges that executives, both men and women, often face due to their demanding roles?
God, that's a good question. That's a good question. Immediately, I will tell you that there is an epidemic of sleep disturbance. Almost 90% of the executives that I see have a difficult time staying asleep. Let's talking about sleep. There's two major buckets of sleep disturbances. One's an organic disturbance where you have a problem. You have sleep apnea, or you have an enlarged prostate that causes you to have to wake up and go to the bathroom, or women having hot flashes, causing them not to sleep. We're not talking about that. We're talking about executives that ruminate. They wake up. The typical scenario is they don't have any trouble falling asleep, but at 3 o'clock in the morning, you can set your watch by it. Boom, they're awake and they're thinking about the next day. That is a problem, because it leads to fatigue, and fatigue will lead to poor performance. Poor performance will lead to worsening of the sleep problem. It's a vicious cycle that's got to be broken. So that's probably the number one thing that I see in counsel on a daily basis. Number 2, weight gain. I mean, you guys, the amount of entertaining you have to do and the availability of high caloric foods, it's almost impossible not to gain weight. The problem is you're looking at prediabetes, and diabetes is being an epidemic in this country as well. And diabetes is the number 1 risk factor for having a heart attack, which is the number 1 killer in this country. So sleep disturbance, weight gain. The third thing I would say would be the challenge of getting routine health maintenance things, kind of like the things that the ancillary things like colonoscopy, or like mammograms, or DEXA scans for bone density, or skin exams, or dental exams. These are the things that kind of get pushed to the back burner because why? Just don't have enough time. And I find in my world, when these executives come in, that there are gaps in that care where that's not being done, and we have to help them facilitate that many times to get it done.
So are there specific age-related health concerns that business executives should be aware of, and how can they address them proactively?
We mentioned colonoscopy, and that's a biggie, and I'll tell you why. The age at which it is recommended to get a colonoscopy now has dropped to 45. Colonoscopy is the number 2 cancer killer in this country. It's very important. And Colonoscopy is the best screening test we have for cancer. In fact, I don't know if you know this or not, but colonoscopy is the only cancer screening test that actually cures the cancer that it's looking for. When they go in there and they snip out that precancerous polyp, they just cured cancer. That cancerous polyp was going to turn into a colon cancer. And by having a colonoscopy and they remove that polyp, you've just been essentially cured of cancer. Yet, only 30% of the executives that we see have ever had a colonoscopy. Too busy, not enough time, that kind of thing. And what do they need to do proactively? Hardwire it into their schedule. You got to get it done. It only takes a half a day, and it will be the best nap you have ever had in your life. I promise you. I've had 3 of them, and it's great. So that would be one. The other one is something that's nobody really thinks about, but there's a huge group of executives who are now over the age of 65. And in persons over 65, they fall down. They break their hip. They get back lumbar fractures. And do you know what the 1-year mortality rate of a hip fracture is in a person older than 65? It's 36%. So 1 out of 3 people die within a year of a hip fracture. So falling down is a bad thing for these older executives. And a lot of people find comfort in staying in their job for years and years. That's great. But we got to have an assessment of your bone strength. We need your vitamin D levels. We need a DEXA scan. And more importantly, you need exercises that function to keep you strong in your core and your proximal muscles so that you can stand up when you fall down or not fall down at all. But falling is probably another biggie that nobody thinks about.
That's great information. What is the importance of regular cardiovascular and heart health assessments for executives?
Oh gosh, how much time do we have? Because this is going to take a while. No, that's probably one of my favorite questions because, as you probably know, heart attack is the #1 killer and cause of death in the United States. 356,000 men and women die from sudden cardiac arrest every single year. Let me put that in perspective for you. That's the equivalent of 5 fully loaded Boeing 737s crashing, killing everybody on board every single day of the year. It's amazing. And for over half of the people, death is their first symptom of coronary disease. That was their first sign that they had it. And the majority of these heart attack victims, they have cholesterols that were really considered acceptable, not really elevated. So cholesterol is really not the best indicator for somebody that's at risk for having a sudden cardiac arrest. There are 2 types of heart attacks, and I think everybody needs to understand this. First one's called a ST segment elevation myocardial infarction, STEMI if you're in the business. And the key about a STEMI is this. All right, this is how it looks. Oh, Penny, I think I'm having a heart attack. Get me to the hospital. I'm short of breath. I've got chest tightness. I've got chest pain. If Penny can get me to any emergency room in this city, in this state, I've got an 80% chance of surviving that heart attack. Sudden cardiac arrest is very different. The survival rate of a sudden cardiac arrest is 9%. And this is what a sudden cardiac arrest looks like. You're here 1 second, you're gone the next. And it hits because you've got a rupture of a coronary plaque, and over half of the culprit lesions that cause a sudden cardiac arrest cause less than 50% blockage in the coronary vessel, so they don't routinely show up on stress tests. You're going to pass a stress test with flying colors, and that explains how you hear over and over again how these individuals have a sudden cardiac arrest, but they just saw a doctor 6 weeks ago. How can that be? They just had a stress test. Well, that's why. It's because a lot of these lesions don't block the coronary vessels. So all executives and all people, frankly, If you're in the business of living as long as you want to live, need to have a coronary calcium test. It's a CT scan. It takes 7 minutes. It answers the question, do I have heart blockage? Yes or no. It's that simple. And once you have that information, then you can take the steps that are necessary to minimize the risk of having that coronary event. All you got to do is ask your doctor to order it. He should know how to order it. Now, with an asterisk, insurance doesn't pay for it. Costs $100, but that's a small price to pay to find out if you actually have heart blockage or not.
Absolutely. Very valuable information. Thank you for sharing that.
Welcome.
How does regular exercise contribute to executive wellness, and what types of workouts are suitable for busy professionals?
That's another good question, and I put a book over here it's one of my favorite new books. It's by Dr. Peter Attia. It's called Outlive, and to quote Dr. Attia, to me is a genius. He said, "Exercise might be the most important drug we have for extending the quality and perhaps the quantity of years of life. Nothing comes close to having a greater impact on the length and quality of your life than exercise. And unfortunately, we can't put it in a pill." Which I thought was a really, really cool way of putting it. So your question is, how does regular exercise contribute? It's going to save your life. Now, I don't love exercise. A lot of guys I know do not love exercise. But the data is overwhelming that is going to be the thing that is going to lead us to the best chance at living a long life. How do you do it? Keep it simple. Just keep it simple. You got to hardwire it into your schedule. 3 separate hours per week that are protected. Nobody can schedule anything during these 3 hours unless you give them permission. And during this hour, you're going to do 35 minutes of cardio. Pick your exercise. Doesn't matter what it is. Walking, jogging, rowing, don't care. You're going to do this particular exercise until the point where you're uncomfortable. And then you're going to hold that for 35 minutes. After you do that, you're going to do 20 minutes of resistance. Again, it really doesn't matter. You do a circuit thing where you do upper body resistance, then lower body resistance. 20 minutes. 5 minutes of cool down, you're out. 3 days a week. If you want to go crazy, do it 4 days a week. But the most important thing is to hardwire that into your schedule and do it every single week.
That sounds very manageable.
It sounds that way, but it's more difficult than you think because there's always something that seems to come up and be a priority. But that's why I call it protected time. Nobody can block on it.
Absolutely. How can executives balance their work commitments with self-care routines to improve their overall well-being?
Well, I've learned that executives do well. They live by their schedule. They live by their schedule. So anything that you believe that contributes to your health should be blocked out and scheduled during your week. Otherwise, it's not going to get done. Whether it's a colonoscopy or a doctor visit or a jog or whatever, it's got to be scheduled in your week. Same holds true for non-work stuff like tennis or golf or fishing. If you don't block it in your schedule, it is not going to get done because there's always something that is going to come in. And it's the key is to create balance. You test that, then you rebalance if necessary.
Building off of that, can you provide some tips for busy executives to manage time effectively to prioritize their health and wellness?
I'm not going to pretend to be an expert at this, but I know somebody that is. Another favorite book of mine. Jim Lair is a sports psychologist. This was probably my most favorite book of all times. It's called The Power of Full Engagement. And basically what Jim Lair talks about is creating rituals. Everything should be ritualized because rituals free up time and time gives you energy. So, I would read this book if that's, if anybody's interested in that. It changed my life. for the good, because I learned how to work in bursts. And that's how he trains athletes, to work in bursts, take a break. Then you work again in another burst and take a break. For me, go see a couple of patients, come back. As I write my note, I'm listening to music, or listen to a stand-up comedian, but something that breaks my brain and gives me some enjoyment, and then back at it again. But if I work linearly, where it's continual, you're not as efficient. You're just not as efficient. So that's my secret. Jim Lair, powerful engagement.
I love that. What are the best practices for managing stress in the workplace, and how can executives build resilience?
Well, we kind of sort of talked about this earlier. There's good stress and bad stress. I mean, after all, you didn't get to be where you are now without stress in your life. And we've all learned how to manage that stress and actually capitalize on that stress. The problem is when the bad stress comes in, when you can't turn it off. I mean, I get through a stressful day, and sometimes I go home feeling rejuvenated because I've done so many great things, but then I might not be able to sleep that night. And I'm sure I'm speaking for a lot of people out there. I hate to say it again, but it starts with sleep. It starts with sleep. And another favorite book of mine, and I don't know any of these authors, by the way, but this guy is phenomenal. Matthew Walker, Why We Sleep. This was another great book to read. I had no idea, for example, that so much caffeine was killing me as far as my ability to relax. I'd have coffee after supper at nighttime, realizing I wasn't sleeping. So I learned from this book, I have to kill the caffeine no later than, and have no caffeine by 2 p.m. And the first time I did that, I slept like I'd taken a sleeping pill. It was fantastic. So the other thing, again, back to stress management during the week, Jim Lair's book, Working in Bursts, working in segments as opposed to working linearly.
I like it. The caffeine is probably something that impacts a lot of folks.
I had no idea. I mean, I convinced myself that I was an anomaly somehow. I could drink coffee after supper and get away with it. Boy, was I wrong.
What are the potential risks of neglecting mental health for professionals, and what strategies can executives use to maintain good mental health?
Well, mental health is a broad umbrella. I mean, you could look at mental health as being one of many things, but I would say the biggest mental health issue that I see among executives is anxiety. That's the easy answer, anxiety, but it's true. It's true. It affects sleep. Sleep, again, ultimately leads to poor performances again, which leads to more anxiety, which leads to more sleep. It's a vicious cycle, and you got to address the anxiety. And all the things we've talked about today are important in bringing that anxiety down. Second would be depression. I mean, it's obvious that depression can pop in even to highly successful people, because somehow they tell themselves they're not doing enough and there's more. Or even the executive that is approaching retirement, they're trying to figure out their purpose and where did they miss. So these are things where an executive coach may come into play. I mean, my job is to get them into a position where they know where they are from a health standpoint. And I have resources available to me, executive coaches and nutritionists and performance coaches that will help me in this area once I identify whether anxiety is predominant or depression is predominant. And it's just a matter, and that's where this individual, when you have time to sit down with individuals and spend time with them, and they are vulnerable with me, it makes it a lot easier for me to help them.
Awesome. So as we wrap up, what are the top 3 wellness habits that executives can start implementing immediately for positive results?
Okay. So let's talk financial term I like to throw out there is return on investment. Where are you going to get your most bang for your buck, right? Where are you going to get your biggest ROI? And the easy answers would be, oh, diet, exercise, and weight loss. But I want to be more specific. I really do. You've heard me say it 50 times probably already. And we're talking about habits now. 3 wellness habits, right? That's what you want. The habit number 1, sleep better. Get in the habit of sleeping better. And you've got to consult with whoever you have got to consult with to get yourself sleeping. And what the goal would be is 6 hours of uninterrupted sleep every single night. Doesn't sound like much, but it's very difficult for these executives. You got to figure out how to do it. What's keeping you from sleeping 6 hours? Is it prostate issues? Is it hot flashes? Is it too much alcohol close to bedtime? Not sure. You got to figure that out. That would be number 1. And I'm telling you, it will change your life. Number 2, get in the habit of eating less. He said that. Yes. Weight gain leads to all bad things. Weight loss leads to all good things. Everybody's on the Ozempic trail. Everybody's trying to get there somehow, some way. It really doesn't matter. Do I like it? I don't like prescribing Ozempic. I really don't. But if I can get 40 pounds off of a guy or 40 pounds off a girl, off a woman, I'll do whatever I got to do because it may help them sleep better. But eating less is going to be a good habit. There's one of the things you can do when you're 80% full, stop. 80% full rule, stop eating. I don't care. It's okay. You don't have to eat everything on your plate. And number 3 is get in the habit of having a regular health assessment. There's no way to run a company without data, and there's no possible way to manage your own health without a health assessment. I mean, imagine sitting in the parking lot of a store, and there's cars coming and going. I'm sitting there with an executive, and I say, boy, that store must be making a lot of money. Look at all those cars coming and going. And a good executive will look at me and say, Kurt, you don't know that that's true. Let me see their financials. They could be losing money. You just don't know. So get a doctor that you can trust, someone who will take the time to listen to you and gives you the feedback, the honest feedback that you can clearly understand and do something with. And this is what I like to say, and it seems to work. Everybody out there, many people out there have probably written a business plan, right? For a company, maybe in college, but somebody's written business plans. Treat you as your next company. Write your own business plan. I mean mission statement, goals and objectives, strategy, and you write that down. Take the time, really put it into play. And once you get that business plan for you, your company, put it in your desk drawer and refer to it over and over and over again when things are going bad. If it doesn't fit your business plan, quit doing it. And conversely, if it will help your business, do it. So, and it just kind of helps them see that we can bring your health into a company-like environment. Treat yourself like your next company.
That is fantastic advice. Thank you so much for being with us today. We appreciate it.
I can't thank you enough for having me.
And thanks also to our viewers for joining us today, as well as our sponsor, the East Baton Rouge Parish Library. Please join us again for the March 20th episode of Strictly Business. Until then, enjoy and make your day a great one.